Okay, let's learn about acute cholecystitis and acute cholangitis. Okay, and what is acute cholecystitis? Basically, acute cholecystitis is inflammation. Okay, inflammation of gallbladder. Okay, inflammation of gallbladder wall or gallbladder itself, which is almost always due to the obstruction of our cystic duct. Okay, and that can be due to stone or any other things, and which cause biliary stasis. Okay, over there, biliary stasis over there, and due to which there is infection. Okay, bacterial infection is there, and bacterial infection is there, and usually it's due to E. coli or Klebsiella. Okay, so acute cholecystitis is basically inflammation of GB wall due to cystic duct obstruction by a stone, and which causes biliary stasis and bacterial infection. While acute cholangitis is it's an infection. Okay, it's an infection of biliary tree itself, biliary tree, and its biliary tree is due to obstruction of our CBD. Okay, common bile duct obstruction by stone or some worms or like that, or a stricture, something like that, and can be due to malignancy as well. Okay, and which causes biliary stasis, and this biliary stasis ascends. Okay, man might be due to ascending infection. Okay, ascending infection, some organism, this type of organism, okay, goes higher, and there might be more bacterial load as well, and it causes infection of our biliary tree. Okay, and so looking towards the clinical features. Okay, and pain, fever, jaundice. Okay, pain, fever, jaundice, Murphy's sign, and toxicity. We look the difference in clinical feature based on this point. Okay, pain is in our acute cholecystitis, there is our Murphy's sign. Okay, there is constant right upper quadrant pain. Okay, constant right upper quadrant pain, which can sometimes radiate to shoulder or back. Okay, while in acute cholangitis there is right upper quadrant or epigastric pain. Okay, right upper quadrant or epigastric pain, and which is mostly colicky. Okay, colicky colicky before infection sets in. Okay, so basically it's a right upper quadrant or epigastric pain which is initially colicky. Okay, and fever is common here, while in acute cholangitis very high grade picket fence like fever with rigors. Okay, chills and rigor, and jaundice is mild or absent, while it's prominent in acute cholangitis. Okay, and in Murphy's sign is classical. Okay, positive, while Murphy's sign is basically negative in our cholangitis. Okay, in toxicity it's usually localized infection of our gallbladder. It's localized infection of gallbladder, while there is systemic sepsis might occur in acute cholangitis. Okay, so basically acute cholecystitis is an infection of gallbladder, while acute cholangitis is an infection of whole biliary tree because of the obstruction of our CBD duct. Okay, for diagnosis there is certain diagnostic criteria. Okay, what are the diagnostic criteria? Okay, in acute cholecystitis, both of them we diagnose by Tokyo criteria. Okay, Tokyo guideline is very famous guideline for acute cholecystitis and acute cholangitis. Okay, in acute cholecystitis there is pain, localized pain or Murphy's sign positive. There is pain, systemic inflammation, signs of systemic inflammation is there, which is increased WBC, increased CRP or fever. Okay, and there's imaging evidence. Among them there can be A plus B plus minus C. Okay, A B plus minus C. Okay, then we diagnose acute cholecystitis. While for cholangitis, this we often discuss like Charcot's triad will be there, or Reynolds pentard will be there. Okay, Reynolds pentard will be there in Charcot's triad: fever, jaundice, and right upper quadrant pain. While in pentard, we add we add hypotension, and altered sensorium as well. Okay, this is called acute cholangitis pain. Thank you. This much for today.